Now, this is me here today saying that you do not need a degree to become a healthcare assistant in the UK. Anybody can actually become a healthcare assistant in the UK, depending on your choice, depending on what you want to do. If you really want to do the job, you can become a farmer, can become a healthcare assistant in the UK. From my title, a doctor can become a healthcare assistant in the UK. How did that sound to your hearing? I hope that sounded biting to your ear. Yes, doctors, they work here as healthcare assistants. I have seen a lot of them. And this is me here today addressing some of the negative comments I've always, especially from the recent video I uploaded. I've gone through that video, people kept fighting people in the comment section because there was a place I replied that it is ridiculous for an engineer to become a healthcare assistant in the UK, and a lot of people, they kicked against that. Well, I am here today to correct that line of comments. Anybody can become a healthcare assistant in the UK. Doctors, they do work as healthcare assistant in the UK, but they do not end up becoming healthcare assistants. Circumstances would make these people become healthcare assistants in the UK, especially when they are dependents, possibly their wife or their husband. Yes, it's already here working and they move in here. For instance, I've got this lady, she's a radiographer. She got a job from my country to this place. The husband is a doctor working in a big hospital in Nigeria, but the husband joined her in this very country. On getting here in January this year, he couldn't get an opening for him to do plab 1. I'm not talking about plab 2, plab 1. He applied around that February. Do you know when he gets a space to do his plab 1 in this country? December, coming in 2 months' time. So you don't expect a Nigerian man, like we all know, they are all hard-working men. A Nigerian man is not that man that would sit at home. A woman would pay house rent. A woman will provide money for food and all that. They don't feel confident in themselves about such a lifestyle. So what did this young man do? He took up a healthcare assistant job to be helping himself. Because for you to do locums here as a doctor, you must have passed your plab 2. Yes, because you need your license to work, to work as a locum doctor in all these hospitals. You must have done plab 2, so he has to be doing that for the time being. Now, you cannot tell me that a doctor in Nigeria would abandon his profession because he has tried plab 2. Yeah, plab 1, they usually pass it easily. He has tried plab 2. First time he didn't pass, second time, third time, fourth time he did not pass. He will be like, okay, since I wasn't able to pass plab, what I have to do now is to apply for healthcare assistant job in the UK. No doctor in his right thinking senses will try that. What is the difference? Nurses, they have, before now, it is not allowed for international nurses to practice in this country. My housemate, then he studied nursing in Nigeria, practiced in Nigeria. He came into this country, did a 3 years program, community health precisely, and he wasn't allowed to practice. This happened around 2010, 2013. That was when I finished in this country. Until this lady did another program for her to start practicing. Now, a young lady from my church walked into this place. She came to England at the age of 18. Currently, she is 38, like she told me. She trained to become a nurse in this very country, registered nurse in the UK. She practiced, she worked, but in the last 5 years, she went into ministry. That's missionary work, Now, she could not go back to start practicing as a nurse again, having trained, having practiced in this country, because she has been out of job for 5 long years. Now, for her to go back to nursing, because all along I've known her for a year plus, because she teaches my little one in the Sunday school, she's been working as a healthcare assistant, support worker. That's what she's been doing, going from home to home, assisting people, a trained nurse in England. Now, for her to go back to become a nurse, she told me that she has to do what is called refreshing course for 6 months. This is the only way she can go back and start practicing, But in my country back home, I don't think there is anything like a refreshing course. What would make a qualified engineer from my country to come here and take up a healthcare assistant take up a healthcare assistant job role is when the person hasn't been working in his field. You have not been practicing engineering, you have no experience in engineering field. That is the only reason an engineer, because currently in the UK shortage occupation list, different branches of engineering, they have opening in the shortage occupation list. Yes, they are employing them, those in IT, those in digital marketing, those in building, construction. They are employing them directly from our country. Now, secondly, I've got this other friend of mine. He started chatting me up recently that he wants the wife to come here and study something in master's. I said, okay, that is fantastic. Because he has been working since he left the university. I thought he was in oil and gas in Nigeria. I was like, anyway, you are comfortable, you don't need to come here. Yes, you don't need to come to UK, hence your job is paying. He said no, that he's willing to leave the country if there is any avenue for him to do that. I said, okay, now you have a job. Over 10 years, you have been in this particular job. The company is well known and you really want to leave Nigeria. So why do you want your wife to come and study here? Why not you apply for a professional job, get a sponsorship job? I asked him, what is your job position again? He said he's working as the health and safety representative. That's an engineering stuff in his company. I went on Google straight. I searched up for job in that field with visa sponsorship. I sent to him. He was really grateful. Why did I send to him? Because he said he wants to come. Assuming he said he didn't want to come, I would have said, okay, your wife can come. Hence, you want to be visiting. But he has made up his mind. So instead of me saying, okay, your wife should come in and study, it is a waste of money. It is a waste of money and a waste of time, whereby he's in a position to get a sponsorship job in this country. And as soon as he gets the job, the wife and his children would come as his dependent. So why waste the money? And he was sincerely grateful that I could tell him such a thing, because he didn't know that he could actually get a job, an engineer working in health and safety department. So this is what a lot of people do not know. I have also had a midwife who wants to come down to the role of this healthcare assistant in the UK. Why? Because she has tried writing ielts severally, I think 3 times, but she wasn't able to beat the cutoff mark. That notwithstanding, there are other tests of English people do not know. When I was in Saudi Arabia, my next door neighbor, a Nigerian doctor, the wife is a nurse. What happened? She came visiting in Saudi Arabia. She didn't spend 8 months in Saudi Arabia. She left Saudi Arabia to UK. Right in Saudi Arabia, this lady, she wrote OET exam. She passed. And they sent her invitation. She did the interview. They sent her invitation to come here. She came to England before the husband. The husband, who is a doctor, actually joined the wife here as a dependent. So when the man came to England, depending on the wife's visa, he started writing plab. So this is how it goes. If you cannot pass, what is it called, IELTS, why not try OET? A lot of people who have done this exam, IELTS and OET, claim that it is easy to pass OET as against IELTS. And nurses, they can do OET. I don't know if a lot of African nurses are aware of this, that they can write OET instead of, what is it called, IELTS. There is another test of English, PTE, that people can do. It is also done in Lagos. This is not funny, to be honest with you, because when you start working here, from that top, a midwife, oh my goodness, you come down to a healthcare assistant. Sometimes they might ask you to do something that you know that it is not in your position to do that. Doctors in this country, for instance, I don't think that they do medication. They don't do injection. They do consultation. They do prescription and all that. Imagine asking a doctor to clean bum. I've worked in a blood-borne hospital. One of the days I walked into a ward. The nurses there, they were complaining. They asked me where I come from. I said Nigeria. They said one Nigerian healthcare assistant that claimed that he was a doctor or he is a doctor was insulting all of them. So fortunately, as I was leaving, because it was a night shift, as I was leaving in the morning, I ran into the same doctor. He started telling me, oh, did I work in Ward A? I say yes. He started sharing his encounter with them. that they asked him. They were just sending him message anyhow. It's because he has not passed his plab. He shouldn't be working as a healthcare assistant. But who cares? Who cares? It's the job you took up. Yes, you took up that role. You want the money. Why not mellow down? A lot of maybe bank managers, accountants back home who came in here as dependents, and they are not able to get a job in their field yet. In quote, I said yet. Because I've always advised in my video, if you come in here as a dependent, take up the available job so that you can be, raising a few quid for your family, to sustain your family while looking for a professional job. Yes, this is the way to go about it. So a lot of doctors and all these highly qualified individuals from Africa, when they come here, they take up such menial jobs, security job, bouncers job, bar attendants. They don't complain. They don't even tell people that, oh, I have attained to certain positions I have attained to certain high position in my country. You don't need to talk about that, because they will be looking at you as if you have lost it. They'll be like, how could you have gotten such a degree, have such work experience in your country, and you come down here to take up a job that are meant for people without degree? In this very country, anybody can become a healthcare assistant. Once you want the job, go on Google, healthcare assistant jobs without experience. They will all pop up for you. But what will happen? They train you on the job. Before you start working, they give you induction, and they give you all the care trainings required, all this training that you're doing on Florence for free. This is what the agency would ask you to do if you haven't done them. But if you have already done them, you can provide a certificate whereby they will do induction for you. So anybody can take up this job. A lot of people, a lot of the locals, British people that are doing this job, healthcare assistants, a lot of them do not. My manager has not been to the university where I recently resigned from. He hasn't been to the college, he hasn't been to the university, but he is a manager in where I am currently working. And I have a degree from this very country. So please, before you crucify me, endeavor to understand me. If you are already in this country, you can take up any job. But if you are already working, especially now that things have changed, like I said before, now you cannot even study nursing in the UK. But right now, if you study engineering, if you are a teacher, you want to switch to study nursing, it is very easy. You are only required to provide 500 hours of working experience in a healthcare setting for you to apply to study nursing in this country for 2 years. Hence, you are already a graduate in different fields. You see how easy it is. But before now, such things are not done. Before now, they don't give sponsorship job to healthcare assistants that are not listed. Even nurses who passed abroad, who trained in Africa are not allowed to come in here and practice. But now the doors are opened. Why not you try? If you fail, you try again. If you fail, you try again. So my very annoyance was basically the responses that senior nurse gave to the home office. You see, even the employer, she was angry when expressing herself because she least expected the nurse to give such an answer to the home office. Had it been she was like, okay, she has tried ielts 3-4 times, she couldn't pass. She decided to come in here because she didn't have money again to keep trying. She decided to come in here, work as a healthcare assistant to raise money to do her ielts. That would have been more understandable. Like one of you put in the comment section, that would have been more something to digest better, as against her saying that she needed to, she switched to a healthcare assistant job role because it's more challenging than a nursing profession. It's quite complicating. So please endeavor to quote me right. I have a lot of videos talking about your job roles as healthcare assistant, how to become a senior healthcare assistant in the UK. I've made a lot of videos about this. I've also worked as a healthcare assistant in several places, despite me being a graduate in the UK. So I wouldn't stop anyone. I'm not a witch. I am not an enemy of progress. Please, I keep it real. I keep it open in this very channel. Thank you for your time.